Hi, do you ever wonder how a doctor knows if a certain treatment works? Well, that's where medical studies and clinical trials come into play. Let's talk about it. So, there are studies called clinical trials where researchers test if a new treatment or therapy works and whether it's safe using real people. Sometimes the people in the study will get the treatment or the intervention, and other groups of people will get the standard care or the placebo. And in some clinical trials, the researchers won't know who got what so that when they're analyzing the data, it will be fair. Other types of studies, like an observational study. Observational studies do not test the treatment, they observe. And they observe a connection over a long period of time, usually in a large group of patients, and it does not explain cause and effect. So you may have heard about systematic reviews. And these are studies where researchers are reading on all the past studies on a particular topic and pull together the big picture on what these studies are saying about that topic. Another study called meta-analysis is very similar to a systematic review, but includes more statistics. And with meta-analysis, researchers are combining results across multiple studies to see what the trend is, what the pattern is. So knowing more about clinical trials and the other medical studies can make us feel more confident and comfortable to ask our providers questions. So if a study sounds too good to be true, or if it's a really small study, it's okay to ask our providers more questions to understand how the data was analyzed and what type of patients were included. Parenting already has a lot of guesswork, so evidence-based information helps us better care for our kids.